Experts, your questions. Joining us now is Dr. Steve Krager from Clark County and Multnomah County Communicable Disease Director Kim Toevs. All right, one of the things that we're hearing is that maybe this virus could mutate again and then become something else or become more dangerous. Is that much of a concern?
That's hard to say. Every virus has the potential to mutate. I think it's dangerous enough as it is, and we should focus on what we can do with what we know about it. And speculating, I think, isn't going to be too helpful right now.
I'm getting a lot of questions from folks, maybe you guys can answer, about the benefits of taking, say, ibuprofen over acetaminophen. And is there a difference, and is one worse than the other?
So there was a report that there was a theoretical risk with ibuprofen of potentially making the disease worse if you have it. Actually, I looked at this today, and the WHO released a statement saying that there's no true evidence that ibuprofen is going to make the disease worse. There was this theoretical concern, but there's actually not much evidence to back it up. So I think you'd be safe to use ibuprofen, be safe to use acetaminophen as long as that's safe for you. So there's certain people that can't take those medicines anyway. Yeah, you should be safe taking them.
A question for Kim. A viewer wants to know why the daycare is still open, and also kind of goes in concert with these huge lines at the grocery stores. You're asking for social distancing, then you smash all these people together.
Well, the exciting news for us, frustrating news as well for folks, but more importantly is that a lot of our grocery stores are grappling right now, and some of them have sent their plans to us for review. They're working hard to figure out operationally how can they space people out of the register, clean the registers in between uses, should they only let a certain number of folks in the door at a time? How can they can understand that if, sometimes only one person can't shop for a household. If you're a single parent with kids, your kids come with you. So trying to be really, really flexible and supportive of the folks who need to buy groceries, and yet set up the structure in a way that facilitates and supports people having the distancing they need. We've been reviewing those. They're creative. They're as customer friendly as they can make them. I think that you'll probably see those enacted in the next few days. And I think that that'll be a good, important thing. We certainly support those kinds of efforts, and at the same time keeping the stores open. I mean, our goal is to keep all essential services open that need to be done, and to just really support folks to find really creative ways to do that in ways that keep the employees safe as well as keep the customers safe.
Maybe in the same vein of that, I have a question here from a viewer wondering if COVID-19 can survive on takeout containers, packages in the mail. I know a lot of kids who are at home are writing letters and drawing pictures and being creative. They want to send things to our seniors who are in homes and not able to get any visitors. Can you speak at all to if there should be any worry in the mail like that?
So there's some very early preliminary studies that have been done trying to see how long it can live on surfaces, and it's a little bit longer than we had originally thought. So for like a really smooth surface like plastic, stainless steel, it's potentially can live for 2 to 3 days. Things like paper and cardboard, it does not seem to live as long, 12 to 24 hours. You could take practical steps and leave a package outside in the sun if it's sunny, and that could potentially do a good job of disinfecting that. But something in the mail, if it's going to take 2-3 days to get somewhere, I wouldn't be concerned.
And Kim had kind of made quick a point to that about if you were outside at playgrounds, is that true for the equipment too? The sun can kill a lot of germs.
If it's very sunny, yeah, I'll let Kim answer that, yeah.
Sure. I mean, I think that we want to have kids wash hands before they play. We want to have kids wash hands after they play. You might think about having kids play in ways that they're not touching a lot of the same surfaces together. But now that it's finally becoming sunny in the springtime here, sun is actually an incredible disinfectant. So probably more important to have your kids get out and get some exercise and not get cooped up. But again, I would wash hands before and after. Older kids are a little bit better at keeping their hands out of their mouths than the really wee ones, and probably the really wee ones I would not have out in a place where they're touching a lot of stuff other people have been touching, just because it's their nature to put their hands right into their mouths. Yeah.
Washing hands. I am going through a lot of lotion also. We're going to take a quick break. We'll be right back with more of your questions.